So if you're not used to introspecting and then suddenly you take a psychedelic and all your defenses melt and you're looking at yourself in the mirror for the first time,
Horrifying.
it can be pretty scary. There were a group of individuals that just didn't get depressed. They're not genetically capable of getting depressed. We don't know what that is. I've raised 5 times more money for psychedelics than I have for the Institute for Early Life Adversity Research. There's the data.
Dr. Nemeroff is the head of behavioral sciences at University of Texas, and he's also the co-chair of the Center for Psychedelic Research and Early Childhood Trauma. He's also the kind of guy that you wish could be your mentor, the kind of guy that you want to go fly fishing with. He fly fishes, and he's like loosely invited me. I'm not sure if it's a real invite, but I hope it is, because the second my kids are old enough for me to leave for longer periods of time, I think I'm going to go fly fishing with him. If he's serious about the invite, it'd be really fun. We're really excited that he came by our studio. We had an awesome conversation with him, and I hope you enjoy it. The thing that I have been frustrated by in the psychedelic world, people kind of turn it into a god. You know, in Judaism, it's like a false idol, and they see it as an end rather than one of the many means.
It's like a religion. We're seeing more and more people that have had bad experiences.
That's not a bad place to start. So you've been seeing more patients with bad experiences?
Well, people write to me because of our role at the University of Texas Psychedelic Center. They write to me because they want help. This is not a random sample. Yesterday, I got an email from a young woman whose family member had an incredibly bad experience with 5-MeO-DMT, but the reason was that he was on a medication that interacted terribly and that, he didn't know any better and he was assured it was safe, and it wasn't safe. He was on a monoamine oxidase inhibitor antidepressant, which you cannot take with a drug like DMT. And then there are other people who just don't have a good experience, right? You know how individual it is.
Yes, it is extremely individual based on my way less experience than you have. I was talking about what you were saying about turning it into a religion and how dangerous that can become just because this is not a religion. The thing that you're an expert in, which is a lot of things, but the thing that I think if people Googled you and they saw your name, it's connected to early childhood trauma. That seems to be the core of a great deal of a lot of our societal issues and personal issues, right? That's where you started your career. And that's why you've gotten into psychedelics. It's because it's a potential other tool in the toolkit to help address those issues, but it's not everything.
So you know me well. So the fact of the matter is that in psychiatry, we're pretty good at treating people with depression. We're not bad at treating people with PTSD. But when you have a history of childhood maltreatment and you have one of those disorders, then you're inordinately harder to treat. And so what we're trying to figure out is, are psychedelics one of the tools in the toolbox that could help us with this group of patients, very sizable number of people, who don't respond to conventional treatments, and partly because they have a history of childhood abuse and neglect.
So far, are you optimistic that it could be an effective tool in the mainstream?
It's a testable hypothesis, and we're going to get the answer when we do the studies. It's too early to tell right now, but there isn't anything else on the horizon that may or be effective in this regard. My concern, getting back to your comment about this being a religion, is you can't be the orchestra that plays one tune. And as a physician, you know that no treatment works for everybody, certainly not in psychiatry. Diabetes is different. If you have diabetes and you see your doctor, they're going to prescribe metformin for you, and it'll work 90% of the time. Psychiatry is not like that. And so we need to understand who the treatments that we have fit best to the individual. And that's personalized medicine and psychiatry, and it's in its infancy.
It's rough because you have to raise money. And it seems like right now the shiny new object is psychedelics, and that's a really great touchstone for fundraising. But you have to balance that against how distracting it can be from all the other valuable work you do.
I've raised 5 times more money for psychedelics than I have for the Institute for Early Life Adversity Research. There's the data. You're absolutely right.
In my mind, and one is far more important than the other, early childhood data is something we should all be fascinated in and extremely interested in. And psychedelics is something I'm interested in, but doesn't seem nearly as weighty.
The truth is that early life adversity in the form of abuse, neglect, trauma, is more an important determinant of adult health than any other single factor. Maybe genetics, maybe equal, maybe not. But put it this way, it's more powerful in predicting physical health and mental health than smoking 4 packs of cigarettes a day determines whether you get lung cancer. It's that powerful.
Given that it has such a huge impact, I think a lot of I'm a parent. I have 3 kids that are under 3, basically. My oldest just turned 3.
Mazel tov.
Thank you. I appreciate that. What should we as parents know about how not to negatively traumatize our kids?
You know, the developing brain is very vulnerable to insult. And the adult human brain isn't mature until age 24. And that's why adolescents have such bad judgment at times. And it's why we don't let our children wander around in the street, because their brain isn't developed yet. Insults like alcohol, like drugs of abuse, cannabis, during that period of time when the brain is developing is not good. And it increases risk for several disorders. First, because it probably increases risk combined with genetic vulnerabilities. Secondly, using alcohol and substances as an adolescent puts you in jeopardy of trauma. You're more likely to have a car accident if you're under the influence, if you're an adolescent. You're more likely to be put in a compromised situation and end up being with a sexual trauma. You're sort of in the golden age with your kids at 3 and younger. You can pretty much control their environment. But as they age, you want to be a good parent, and part of being a good parent is, of course, allowing your children a certain level of what we call separation and individuation, become their own person, right? That's a good thing.
Right.
But it has to be done in a safe context.
Are there certain things we can do to encourage resiliency?
Part of resiliency is probably genetically determined, because, you know, if you take 100 kids who are 3 years old and put them in a room, 10 at a time, 1 or 2 of them will go off in a corner and won't interact with any other kid because they're anxious, and the rest of them will be very gregarious. So you have to know whether your child is one of those 1 or 2 kids. And if they are, then they're going to be at risk for anxiety, and they're probably going to be at risk for alcohol and substance use, because it'll quiet their anxiety, at least initially. So you could look out for those warning signs. But, you know, there's no substitute for the love that you give your child, the safety that they feel when they're around you. I'm a big fan of pets because, you know, a relationship with a dog, I'm a dog person, is almost emblematic of a relationship with people. The great thing about dogs is they give you unconditional love.
I love dogs too, but it's so hard to take care of an animal like that when you have 3.
Oh, 3 kids, yeah. Yeah, but they're going to want a dog when they get older, trust me, and you're going to have to cave.
Right. I think it's the right thing to do.
And they'll say, you know what they'll say? I'll take care of it, Daddy, but they won't.
Right. You end up being, and then you end up falling in love with the dog.
Absolutely.
Why is it that certain traumas stick with us unconsciously, even when we've been able to consciously understand them and address them? And it's still so hard as adults to get over them. Like, what's the mechanism that's at work there?
So there are just some events that occur in your life that become hardwired. So in my generation, there isn't anybody that I would say, where were you when John F. Kennedy was assassinated, who couldn't tell me exactly where they were. Because traumatic events become integrated into your part of your brain called the hippocampus, and it's hard to get out. And traumatic events are very hard to unlearn. So there are things you and I know, like the words to songs or the sports scores last week, but we quickly unlearn them, right? These emotionally laden events, not so easy to unlearn. Both good and bad. So that's true of great events. You remember that great sports victory you had when you were in high school. Maybe you remember your prom, maybe you don't. But unfortunately, negative valence events become hardwired.
Do you remember your prom?
I didn't go to my prom.
Okay. What's the evolutionary reason for that hardwiring?
Yeah, I think evolutionarily, you know, if you're attacked by a bear and you don't forget it, it will be protective for you to not be eaten by a bear in the future. right? But unfortunately, our civilization has evolved so quickly, learning that and having it hardwired isn't maybe so important. When I'm treating a patient who's been sexually assaulted, it's 5 years later, and I'm trying to help a young man or a young woman get back out there. They can't get it out of their minds that if they go to a bar, that someone isn't going to drop a drug into their drink and sexually assault them. It's hard for them to think that anybody of the same gender as the person who assaulted them actually can be trusted.
Another thing that's really interesting to me is someone can suffer a very severe trauma. It ruins their lives or really impacts their lives negatively. Someone else can experience that same exact severe trauma and it turns them into an extremely elite business person. And that's probably something you've encountered.
I'm fortunate to be the director of the Texas Child Trauma Research Network. We've collected 2,000 children statewide in the relative immediate aftermath of trauma. And we're following them for 2 years to try to figure out what predicts them doing well, being resilient, and what predicts them to do badly, develop PTSD, depression, alcohol use disorder, et cetera. So we haven't analyzed the data yet, but about 35% of these kids ages 8 to 20 have no diagnosis. So they've been through, either sexual trauma, physical trauma, medical trauma, animal attack. 30% of them are unscathed to the best that we could tell. So what's that about? Well, if you think about it, look at the most horrific traumatic events in history. Let's look at the Holocaust. Victims of the Holocaust had sustained trauma coupled with malnutrition over a long period of time. Not everybody got depressed. Everybody got angry and worried, but there were a group of individuals that just didn't get depressed. They're not genetically capable of getting depressed. We don't know what that is.
It's like Vietnam War veterans. A lot of them are on the streets and a lot of them are titans of industry. And, maybe they wouldn't have been titans of industry, but for those traumatic experiences that they went through.
It's the Nietzsche quote, right? That's what doesn't kill you makes you stronger. But you don't know for your children who's strong and who's not.
Right.
Right? So you don't want to run that experiment.
No, and it's heartbreaking to see our kid go through anything.
Oh,
that is sad.
It's terrible.
You definitely don't. And a lot of the parents ask, well, what kind of trauma can we introduce to our kids? It's like, the answer is we don't know. So just life has its own share of traumas that your kids will probably experience.
Kids can be cruel. And, one of the things that I always ask patients when I see them is, did you do sleepovers as a child? Because that's a clue about whether they had anxiety or not.
Oh, interesting. I did do sleepovers. Was I anxious about them? Yeah, but I remember being anxious about them, but also weighing how much fun I'd be having with my friends more than the anxiety.
The question is, were you calling your mother and dad and saying, come and get me?
I wasn't doing that, yeah.
No, you didn't, right? Because you don't have an anxiety disorder.
Right.
Right? But when a patient tells me that, I'd go over for an hour and then I'd call my mom and say, you have to come and get me.
No.
Then they already have a predisposition.
I had a friend like that, and he would always leave early, and he would kind of hide that from us, I think, in hindsight. That's really interesting. And we always wondered why he never wanted to hang out longer. That totally checks out also with regard to how he is as an adult. But he was good at hiding it. He was very charismatic and very smart. So a lot of these mental illness issues have become more mainstream and more ubiquitous in conversations in society. Do you think any of it might be overdiagnosed at this point? Do you think things like ADHD are overdiagnosed?
I think psychiatric disorders in general are both underdiagnosed and overdiagnosed. And I think ADHD is probably the poster child for this. So I see patients who come to me and I get a history and they've been suffering with ADHD their whole life, and I put them on appropriate medication, and they're like, oh my God, this is unbelievable. I can't believe I can concentrate, I could focus, I'm less impulsive. And then I have people who come to me and say, I know the reason I did poorly in college is because I had ADHD. And then we test them and find out, no, actually, you didn't do well in college because you're not that smart. Now, I would never say that, but if you have an IQ of 80
Right.
Okay, you're going to
Right.
have a hard time,
Yeah, of
right?
course, of course. I was diagnosed with ADHD as a kid, and my parents put me on Adderall.
Hmm.
I don't know what your experience with Adderall is, but my experience was prolonged and it was overall negative. And I regret that my parents did that to me because I developed a dependence.
It wasn't helpful to you.
Was it helpful? It's really confusing because the first day I took Adderall, I remember I play music, I sing, I play guitar, and I went and I learned the cover of Hallelujah, the Jeff Buckley version, and I nailed it. Like I took the Adderall and I just hyper focused in on this thing, and it became this song I was able to play really well. But also my personality was just dampened.
So what you're discussing is the risk benefit of different medications. So the issue with stimulants is that they have side effects, right? So one, if you have any vulnerability for substance abuse, stimulants are a class of drugs that are abused. Secondly, they reduce your appetite.
I lost a lot of weight, yeah.
If you have a predilection for an eating disorder, stimulants are going to push you over the edge.
By the time I got to late high school and early college, I often felt like I couldn't do assignments unless I took the Adderall. And that's when I decided in early college I needed to really stop using them because I wanted to be able to feel like I could do stuff.
So it's like all treatments. They're good for some people and not good for others.
How do you tell patients who have ADIQs that it's not the ADHD? How do you deliver that message?
Well, obviously, I don't say that. What we do is, and it disturbs me that so many people come in having been diagnosed with ADHD but never had the testing to determine it. So if you see a pediatrician and you say, my kid's having trouble sitting still in class, that's not the diagnosis. So a lot of people come in and then we do the workup and they don't test positive. So we also want to rule out dyslexia and other causes, and dyscalculia, which is the math equivalent of dyslexia. So those are learning disabilities that people could have, but they're not ADHD. But sometimes people from very high achieving families, just aren't that smart. It's not their fault, and they're great people. And generally what I say is, whatever ails you, it's not ADHD. But we could help and work with you using psychological skills to help you focus more.
Man, there must be a way, too, to help people become introspective enough to realize that they're not that intelligent in a way that's healthy, right? And then and not to make it about, and not to harm their egos in a way that makes them depressed.
Well, we could have an entire discussion about the broad spectrum of introspectability, right, which is extremely variable from person to person. And you and I know people that are really great people that never sort of think, well, who am I? Where am I in the universe? How do other people perceive me? What do my family members think of me? Am I a good dad? Am I a good partner to my spouse? There are people that just aren't made that way.
When I run into people like that, it's so claustrophobic because I feel like we're just speaking two different languages.
Because you are.
Well, advice about how to deal with those people.
Well, I will say one thing about those people. They don't do well with psychedelics.
Do you think that there's a connection between the ability to be introspective and the Jewish relationship with psychedelics?
I've never thought about that. It's an interesting question. There is a sort of tradition and heritage in Judaism to introspect and ask questions about oneself and the people around you. And, I think that can be true in many religions. I think that if you're not introspective, and what psychedelics do, as we've talked about before, is they tear away your defenses. So if you're not used to introspecting and then suddenly you take a psychedelic and all your defenses melt and you're looking at yourself in the mirror for the first time,
Horrifying.
It can be pretty scary.
You probably know this, but since psychedelics have become more mainstream so rapidly over the past several years, you have Hasidic rabbis in Williamsburg recommending that their more atheist members of their community go on journeys because they're hoping that they're going to find God.
It's not limited to Judaism, right?
No, of course not. Yeah. I mean, psychedelics has become mainstream everywhere. I have conservative Republican friends who are going very quietly on their own psychedelic retreats. Most of the people in my life have had positive stories and interactions with the substance. But it should be noted that there seems to be a high connection with Ashkenazi Jews and their ability to appreciate psychedelics as compared to other groups that I have
It
actually.
may be a sampling bias.
I only know Jews.
Well, there you go,
Oh,
right?
it's
Right?
it's a good
You have
point.
to remember that.
I mean, I'm half Mexican, so I know a lot of Mexicans, and then obviously I know a lot of Jews, and then but out of my close friends that aren't Jewish versus the ones that are, the ones that are Jewish happen to just appreciate it more than the ones that aren't. And I don't know what that is. And maybe it's just this small sample size, which is very highly unscientific and,
Right.
Strictly anecdotal.
These are all testable hypotheses.
Yeah. And that's why we need to fund your research center.
Absolutely.
But really the childhood trauma one is where people should be directing their attention.
As the chair of the department, I love all of my children, meaning all of the different centers that we have. We're opening a new trauma center, so we're going to start seeing adults, and we're going to train people how to treat trauma as well. So I love that. I love our bipolar center. I love the Early Life Adversity Institute, and I think the Psychedelic Center is important because we need to put some science behind it.
So did you have a fairly secure childhood?
I would say it was sort of rough. So I think, I was brought up in the ghetto in the Bronx. We lived on the top floor of a tenement. I was aspiring to someday live in a building that had an elevator. Went to public school. It was a pretty rough neighborhood. A lot of trauma relationship to fighting. As a kid, my mother could have been nicer.
When you look back at what you were like as a kid, do you ever see kind of glimpses of the future psychiatrist in that child?
Well, there's not a coincidence that both my sister and I went into mental health. It should tell you something.
Do you have experiences in your memory of helping people and when you were in high school or younger, maybe even younger?
Yeah, I think I always, because I didn't particularly have the best parenting, I always sought my relationships in my friends. And so I developed a very close network of friends, and they sort of acted as my support system. And part of that, of course, is trying to help people through hard times. I'll tell you one very personal anecdote. So my father, remarkably, arranged for me to go to summer camp.
Jewish?
Yes, Jewish camp, when I was 11, 12, around like that. And this was, all the kids were coming from either Westchester or Long Island, and they were the very wealthy Jewish families, and I wasn't. And what I discovered there was that in these kids telling me what their lives was like, it was really like Leave It to Beaver, Father Knows Best, My Three Sons. It was this sort of idyllic childhood, which I thought was like impossible. And it sort of opened this up to me to realize what was possible versus, living essentially in the ghetto.
You're Jewish. Did your parents put you in Hebrew school? Did they put you?
Oh, yeah. I went to Hebrew school 7 days a week between the ages of 7 and 13.
Wow. And so Judaism was obviously important to your parents, or whatever version of it was in your neighborhood in the Bronx. As an adult, you're not as connected to Judaism anymore.
I'm not.
How did you depart from Judaism?
The day at my bar mitzvah, the rabbi said to me, "See you next week." And I said, "Not a chance." Because I had done 7 days a week for 6 years.
It's too much.
That was one thing. And the other thing, which you'll laugh about, the rabbi at one of our classroom episodes was very clear that dogs did not go to heaven. And I said, "Well, how do you know that?" And he said, "Well, it's written, that's why." And I thought to myself, you know what? If dogs don't go to heaven, I don't want any part of this.
Yeah, God, that's not a Jewish known thing. And the reason I'm so interested in your relationship to Judaism is because you're a psychiatrist. You help people in much of the way that a lot of rabbis, or good rabbis at least, attempt to help people. There's a lot of overlap. There's a Venn diagram between psychiatry and being a rabbi and for a community.
Mm-hmm.
I think that you would actually have a lot more in common with the healthier strains of the American Jewish experience. The problem is that it sounds like your parents put you in a place that wasn't as healthy.
But Aaron, to be fair, and I've been very critical of this, some of the highest rates of child abuse and neglect occur in the Orthodox Jewish.
The Hasidic communities.
Yes, and also domestic violence. And that has really disturbed me.
I think that there's a lot of modern Orthodox Jews and even ultra-Orthodox Jews that would look at that horrified. It's like any group of people. You get anyone who's a religious leader into a position of power.
And we've seen it in the church, We've seen it in the synagogue.
And in psychiatry, there's
A-
plenty of
ab-
therapists.
Absolutely, and a vulnerable population of people taking psychedelics.
That's also extremely scary. And one of the major problems I see in the psychedelic world, they turn this experience into their gods, into idols. And then you have these people that take the positions of high priests within this new
They
world of
do.
gods,
They
right?
do. And it's why in all of our studies we have two therapists with every patient who's being administered a psychedelic to make sure there is never a chance of any untoward behavior.
As a kid, or I guess a young adult, when was the first moment of realizing that you were going to get into mental health?
When I was in college, I was extremely interested in political science and law, but it was during the Vietnam era, and it seemed so broken to me. And I thought, well, science is pure. At least I believed that at the time. And then medicine seemed to be something I could relate to in terms of helping people and data driven. So when I went to medical school, I was trying to decide on what specialty I wanted to go into, and I was interested in the brain. So that meant neurology, neurosurgery, or psychiatry. And I thought I could do the most good myself because the great thing about psychiatry is you get to hear people's life stories every day, and that's such a privilege. And think about doing colonoscopies. Like, how
My
could
dad
you?
does that
Oh, yeah?
for a living.
Okay, well, think about that.
He's a gastroenterologist.
How much different, is it every day, right?
No, yeah, he does the same procedure over and over and over again. Yeah, the anus does not have a story to tell, or it does.
Exactly.
Actually, my dad would argue it does.
Oh, it has a story, but it's either okay or terrible,
Right?
right? So I think it's a privilege, and I think the great thing about psychiatry is that because there's so much that we don't know, and a large part of helping people is the relationship between you and the patient.
So when you got into it, it wasn't, mental illness was not this mainstream thing. Like if you were mentally ill, it meant you were on the fringes of the human experience, and it wasn't like everyone should see a therapist.
Oh, no. And psychiatry was the least popular of all the specialties. It was stigmatized because the notion was that, well, either you went into psychiatry because you were afraid of real medicine, blood, guts, all that kind of stuff, or there was sort of something psychiatrically wrong with you that drove you into going into this field. Ironically, here we are 25 years later, psychiatry is one of the most popular of all specialties.
There's probably a lot of factors that could explain why it became popular. Do you ever look back at your time as a student and think, I cannot believe they taught us this in this
Oh,
way?
yeah. When I was a psychiatry resident, we were required to take a rotation in child psychiatry. And so every week, the child psychiatrist would present a case to us. It would be a case of bedwetting, a case of autism, a case of childhood ADHD, different cases. But during the years I was trained, the prescription, the solution was psychoanalysis for the child, every single case. And I remember going to the professor and I said, I've got a real concern about this because no matter what the presentation is, the answer is psychoanalysis. Where's the data that psychoanalysis could treat all these things? And he looked at me, he said, you're a researcher. Let's make a deal. You don't ever come back to this class. I'll pass you, and you just go in the lab because you're a disruptive force.
From asking that question.
Yeah. That was then. Now, of course, we don't use child psychoanalysis to treat these things, but that was the way it was back then.
So you've seen this entire institution evolve, and for the most part better. Have you seen ways it's gotten worse?
The Southern novelist Walker Percy said that psychiatrists were engineers of the synapse. And I'd like to think that we treat brains and minds, which means we have to know about psychotherapy and we have to know about psychopharmacology. And unfortunately, many practitioners in the community just do one or the other. And I think that's a problem because this whole idea of this split model in which a psychiatrist gives you medication, and then a psychologist treats you with therapy. I'm not sanguine with that. I think we need to know how to do both.
When did you develop an interest in early childhood trauma? When was that something that came into your...
When I was about 10.
Right.
I'll tell you an anecdote,
Yeah.
a very personal anecdote. When I was 6 years old, a hurricane came to New York. The school called all of the parents and said, come and get your child. And everybody came except my mother. And there I am with the teacher. And she wants to leave because there's a hurricane, right? And so she finally said to me, why hasn't your mother? I'm 6 years old. She said, I'm going to take you home. So she walked me home. I climbed up the 5 stories rang the bell. My mother answered it. I said, well, why didn't you pick me up? She said, well, I knew somebody would bring you home.
That explains your subconscious interest.
Yeah,
and
I think it was subconscious.
And it probably was always with you.
The other part of this, Aaron, is that when I was a very young faculty member at Duke, and I was running with another psychiatrist a unit of people with depression, and I started asking all of them, and we would keep people for about a month in the hospital. In those days, you could do that. And I would get their life story. There was such a high percentage of child abuse and neglect in their histories. It was just shocking that I started making the connection between child abuse and neglect and adult depression and PTSD.
A friend of mine is a neuroscientist, and she texted me a question about how gut bacteria interacts with mental health and what we now know about that.
Right, so that's called the microbiome. And this is not an area of expertise that I have, but there's a very close relationship between the gut and the brain. We know that from diseases like Crohn's disease, ulcerative colitis, irritable bowel syndrome. We know, for example, in irritable bowel syndrome, incredibly high rates of child abuse and neglect in that population.
Whoa.
Absolutely. So the gut has what's called flora, which are bacteria that live there. Good bacteria, and there are now lots of reports of the microbiome, the local environment in the gut being changed in patients with depression. Whether this will lead to any therapeutic advances or not, too early to tell.
It blows my mind that there's such a high prevalence of abuse for IBS patients.
In the study done at the University of North Carolina, it was 2/3.
Are there any other ailments that have that kind of connection to early childhood abuse?
Child abuse and neglect is associated with increased risk of asthma, diabetes, heart disease, stroke, breast cancer. It makes everything worse, probably because it results in an increase in inflammation, which lasts for a very, very long time. And inflammation is associated with a lot of these disorders.
It comes back to the colonoscopy reference. Did you know my dad was a gastroenterologist?
I did not.
What a crazy thing he does every day. Like, I always think about that. Like,
well, the question is whether he enjoys it.
I think he does.
Because, the thing is, if you're really good at something, and it's really important, I mean, it really is important, and God bless that somebody could do it well, not get bored, tired, burnt out, etc., right? That's a wonderful thing.
I'll send him this clip. I think he's on the spectrum.
Well, it sort of makes a little sense, right? Because the great thing about the spectrum is that you can really focus on one thing.
Right.
And really be great at it.
He's also an amazing tennis player. So he's like a gastroenterologist and a tennis player.
Well, if you're great at 2 things, that's pretty damn good. And you enjoy it. Because most people don't enjoy what they do.
It's so fair. Yeah. I've spoken to you about this in the past. Well, you brought this up at an event we were at, which is basically psychedelic treatment for eating disorders. Have you done more studies in this regard?
Yes, so it's on the list to do a study in anorexia. And the reason that I'm excited about it is if you had to pick one disease that is hardwired, that would be it. Maybe OCD as well, but anorexia, and I've treated these patients, and it's not that they don't want to be better, but there are usually 2 things about them. One is that they have this terribly altered body image. which is, fundamentally on the psychotic range. And secondly, that they actually believe and feel in their heart of hearts that eating is a sin.
What are the most common factors that lead to eating disorders like anorexia?
I think genetics is very prominent, number one. I think there are cultural factors. It doesn't help that we idolize these women more than men, but women who, fundamentally look like they're Holocaust survivors. I'm not on top of modern culture, but when I was your age, that's the way the models all looked. Maybe, I don't know if they still do.
Well, there's an overcorrection recently, and Victoria's Secret had to correct that overcorrection, where they started putting out models that were morbidly obese, which also has its host of problems. But I think that there's a healthy middle ground probably for the societal factor that you're talking about.
Aaron, a game changer are these new medications for weight loss. Ozempic and there's several of them. And the fact is, it's a game changer for treating diabetes and morbid obesity, but you and I both know it will be abused.
I think it's already being abused.
It is.
What is the third factor? Because you were you said the first factor was genetics. Second factor was the cultural sort of pressures.
What the dynamic in the family is. Many of the patients that I've seen with anorexia, not all, but many have had moms and dads who were overly concerned about appearance. As a child, you want more than anything your parents' approval. I saw a patient the other day who literally said to me, when I was 12, they sent me to fat camp, and I wasn't even overweight. Well, that's a message, right?
It's one of those examples of something that I consciously am aware of, and it still is, I'm hardwired a certain way with regard to eating. Like I'm not anorexic, but I certainly have a bad relationship with food in a way that isn't perfectly healthy. And it's one of those things I can't personally get over, and it breaks my heart to learn about what you told me, which is that anorexic patients often die. What's the percentage of fatality is very high?
It's the highest. Of all the psychiatric disorders, has the highest mortality rate.
And it's the one that's the most difficult to treat?
It's very difficult.
So this is why you've been a little more aggressive with your studies regarding psychedelic treatments. It's because the mortality
Absolutely.
is so high.
Because what happens is you end up with a disorder which starts to destroy your peripheral organs. You start getting what's called cardiomyopathy. Your heart starts failing. Your bones fail, so you end up getting fractured. You're 20 years old and you have osteoporosis like you're a 90-year-old. Your brain atrophies, and you haven't had a menstrual cycle in years, right? So the consequences medically are profound. So you want to intercede early.
What are you most worried about with regard to psychedelic research?
The biggest concern I have is widespread demedicalized availability. You and I've talked about this before. You have to distinguish between the use of psychedelics in people without any disorder that want a spiritual awakening or broadening. So that's one group of people. A whole separate area is, are these helpful for treating a psychiatric disorder? In the first group, what worries me is these are folks with no disorder, but they may be genetically vulnerable for a disorder, right? But they haven't had any symptoms. And then they go ahead and take psychedelics, and it triggers an episode, first time, of psychosis, for example, or bipolar disorder. Secondly, these medications do have effects on blood pressure and heart rate. And so if you're vulnerable, you would want this to be done in a medical setting, so in case something bad happened, you could be attended to. Third is, if you're not taking a synthetic medication where you know how many milligrams you're getting, and fundamentally, as my patients have said to me, oh, well, I trust the mushroom guy, he's a good guy, and he told me 3 grams was the right dose, but if it wasn't good, I could go up to 4 or 5 grams. And I'm saying, well, there are differences from batch to batch in terms of the active ingredients, and measuring the weight of a mushroom is not exactly an accurate dose.
And the strains are different.
Right, exactly.
Are you familiar with the different strains, or you just deal with the synthetic?
We only deliver synthetic in clinical trials.
Okay.
We got to know what we're doing.
Right. It's got to be exactly precise
Right.
if people are going to trust your
Right.
data. Can you share a significant breakthrough, either in psychedelics or in the early childhood trauma field, that you're really excited about?
Not particularly in either one of those. There's a group at Stanford led by a guy named Nolan Williams who's developed a new method of transcranial magnetic stimulation to treat very severely refractory depressed patients. And instead of giving it the way it's currently FDA approved, which is one treatment a day for 5 days a week for 6 weeks, he's designed a new method in which you deliver 10 treatments a day for 5 minutes or 10 minutes, 5 days in a row. That's it. And the results thus far have been remarkable.
That's incredible.
Yeah.
And is this a technology that's difficult to replicate?
Well, there's a company that's got FDA approval to start using it in the hospital. It'll start by using outside of the hospital. It's called Accelerated Theta Burst TMS. It's a big breakthrough. The same investigator has a paper in press looking at ibogaine and PTSD.
Martin, the center in Mexico?
Yeah, so Nolan worked with Martin, and the results, it's an open study, so everybody knew what they were getting. There wasn't any placebo, but these were very severe PTSD patients, and the results were astounding.
We should introduce this to the victims of October 7th.
When I talk to people I know in Israel, there is no one that doesn't know somebody that has been either killed or taken as a hostage. No one. What more can you say?
What is something that you wish people understood more about psychiatry, your industry?
The biggest issue remains is a lack of parity in terms of getting treatment. So if you have a lymphoma, your insurance company is going to cover it. If you have PTSD, maybe they will and maybe they won't, but not much. Why is that? Because you can't see the scars. It's not visible. If you lost your leg in Afghanistan, we could see that. But if you have severe PTSD because of what happened there, it's not visible. Why, with all the progress we've made in understanding that these diseases, like all complex diseases, are partly genetic in risk and partly environmental, why is there still so much stigma about psychiatric disorders?
The general trends of the world have been not great recently, very recently. Are you optimistic or cynical about the trends of your profession?
I'm always optimistic.
About the trends of
I'm
psychiatry?
insufferably optimistic. I think the vast majority of people who go into psychiatry and psychology really do want to help other people. I wish that more of them practiced evidence-based medicine and took the results from the research arena and put them in their practice. Relative to when I was a kid, and even when you were a kid, we've made a lot of progress. I mean, look at John Fetterman. He's a senator from Pennsylvania. He was admitted to the hospital with severe depression, was treated with electroconvulsive shock therapy because he didn't respond to anything else. And, he came out and said it.
Right. Okay, so you're a proponent of people being very public with their mental ailments because it leads to people being more comfortable seeking out the help they need.
What was more stigmatizing than HIV? But Magic Johnson came out and other people came out, and it changed the conversation. And we need to do more and more of that with depression and PTSD.
Do you have any specific critiques of academia that you wish could shift?
The current funding climate for research is particularly tough in that there's not enough funding for mental health research, and a lot of it is being directed in ways that I think we could do better.
What would you do differently, though, like for the fundraising part of it? How would you approach it differently?
Well, everybody seems like totally sanguine with the 20th century cure. Let's cure cancer. And we're going to throw $1 billion at it. And the truth is, that's what happened with AIDS. AIDS, during the time I've been a physician, was a terminal illness. And now it's not. It's treatable. Well, how did that happen? Because we threw a lot of money at it. If you say to a lot of smart scientists, we're going to give you millions of dollars if you find a cure for this.
Do you watch South Park?
It'll happen, yeah.
Okay,
well,
so
not in a long time.
Have you seen the episode about AIDS?
No.
It's just Magic Johnson, how he got his AIDS cured.
Uh-huh.
And he was just injecting money into his veins.
Oh, yeah, exactly. But that's never really happened with mental illness, even though it takes its toll.
And maybe that's a good thing, a really positive thing about psychedelics, too, is that it is attracting people to the cause.
But if you think about the horrible state of affairs is that Congress literally sits there and one day the blood people come to them and we want money for leukemia and sickle cell disease. Then the next day the bone people come. And then the next day, the brain people come.
And they all have their industrial complexes that are formed around them and their ecosystems where they're all making money off of any of the money they're able to get.
But if you look at the prevalence rates of these diseases, like I'll give you an example, Parkinson's disease. It's a terrible disease, right? It's relatively uncommon. Compared to depression or PTSD, it's not even close. But it garners a lot of funding.
Humans are crazy. For instance, we want electric driving cars, self-driving cars. We know that'd be much safer, but we're constantly focusing on the edge cases, and that's why we don't have them yet, even though it would be a much safer world if we weren't driving ourselves everywhere. You have to, it's 3:30, so I really appreciate you coming. So who's going to win? Is it going to be the Nuggets again this year, do you think?
Oh, we're talking basketball?
Yeah.
I'm still focused on Texas football here.
Oh, are you a football fan?
I am.
I'm like almost strictly a basketball fan.
Yeah. Obviously, the Lakers are doing very poorly. I was very disappointed that the Heat did not pick up
Damian Lillard.
Yeah.
Who's your team?
The Heat.
Because you were in Miami for a while.
Yeah, and Pat Reilly is a mensch.
Do you know him? Do you know him personally?
I know him very well. He's a wonderful person.
He seems like a good dude.
He is a mensch.
And so Heat culture is real.
It's real. He cares about his players. It's real.
Wow.
Yeah.
Well, I hope you come back. I hope we can get you back here. Thank you.